Split the Pot is a lottery that helps raise funds and awareness of the hospital healthcare system here in our province. One of those hospitals is North York General Hospital. North York's goal is to improve patient care through programs and infrastructure, and Split the Pot is a key piece of achieving that goal. Joining us to talk about this more is Shauna Millar, President and CEO of North York General Foundation, and Dr. Sarah Temple, surgical oncologist at North York General. Good morning to both of you. You look lovely in your pink, which we will talk about, obviously very fitting.
Morning, Lisa.
Thank you so much for joining us on this very important conversation. North York General is doing a lot of good work. A lot of hospitals are doing a lot of good work. And you guys are kind of new to the Split the Pot, and I want to kind of talk about that. What sets you guys aside, and why have you decided to join the Split the Pot lottery?
Yeah, so we joined in June and really wanted to offer our community and our donors another way to give back to the hospital, because all the proceeds that come from Split the Pot support our fundraising priorities at the hospital, and really that's equipment, life-saving care, technology innovations, and we're really grateful for our donor community in giving back through this avenue.
And I'm glad that you touched on that, because I think when people think about lotteries and why they should participate, it's really not just one thing. It's not just the equipment. It's not just the care. It really is a culmination of all of that really goes towards, the whole patient support system. I have spoken openly about, breast cancer affecting my family. I've been so gracious to have the opportunity to join the Ontario Breast Screening Program. Mm-hmm. So, lotteries like this and having that money is so important, for the donor support.
For sure. When you talk about breast cancer, we are raising money right now for a new mammography machine to really support the number of women who need screening each year. That one machine screens 11,000 women each year and men. So that is, really important for us to allow those wait times to be lower so you can get your screening earlier.
Mm-hmm. And the technology is changing as we see the years go on. So it's imperative, right, that these funds are being raised. Dr. Sarah, I want to talk more about, the age of mammography has changed from 50 to 40 kind of recently. Mm-hmm. The importance of that, and have we seen the number of cases change because of that?
So it's interesting. I mean, I think we changed because we had a difference in numbers, and then we're seeing the effects of that. So we've noticed over, the last number of years that the number of patients in their 30s and 40s is increasing. Mm-hmm. And there have been studies that have shown that across North America. So based on that, the United States did it first, and then Ontario followed quickly thereafter to drop that age to 40, mm-hmm. because we knew we needed to be screening this population. Mm-hmm. And definitely we are seeing women in their 40s. Thankfully, because of the screening, we're finding it at an early stage, which is, has a very high survivability. So we're very grateful that we're able to screen these patients and find them early to catch it.
We've talked a lot about different types of cancers, and really the key message really is early detection is so key, and so many of these cancers are preventable. And I know in my experience, I've done my mammograms, and recently, a few months ago, and I posted about it as well, it doesn't hurt, it doesn't take very long, and it's a life-saving thing that can really just change so many lives, right? So this technology is important. Can we talk just more about the donor support at North York General and just what impact this fourth mammography machine would have?
So for us, like I said, we want to screen as many women as we can. Mm-hmm. And when we drop that age by 10 years, that's a lot of more patients that we need to screen. So like Shauna said, 11,000 extra patients we can get in a reasonable time frame. And that's just so important for our community.
Amazing. You're wearing the pink scrubs. We're rocking the pink. Can we just quickly talk a little bit about that? I think for people that have had breast cancer, they kind of know about it. But for those who don't, why the pink?
So pink is the signal of Breast Cancer Awareness Month, and that is October. So we're really have a big push on right now to remind everybody to get their screening. If you haven't done it in the last year or two, depending on your situation, please book your mammogram. Mm-hmm. We want to take good care of you.
Shauna, let's talk about the Split the Pot lottery, where people can get more information if they're watching this morning, if they've sadly been affected by this disease, but they want to participate. Where can people get more information?
Yeah, so they can visit splitthepot.ca. When you check out, we'd love you to select North York General as the hospital that you're going to support for the proceeds from your tickets. Amazing prizes to be won, and just a wonderful way to give back to the hospital.
And there are 83 hospitals in total that are supporting this cause, which is amazing. But, you can support North York General specifically, which is why you guys are here. And quickly, let's talk about there's an early bird jackpot, because the draw is basically every Thursday, if I'm not mistaken. So today is the second early bird jackpot?
Yeah, so we encourage people to go to the site after this segment and really buy your tickets, because the odds are amazing and a great payoff to win something for yourself and give back to the hospital.
Yeah, and lots of prizes, financial prizes, and so much more. So splitthepotlottery.ca is where you can get the information. Thank you so much for joining us this morning, Shauna and Dr. Sarah. This is such an important conversation we're going to continue having, I'm sure, the month of October, Breast Cancer Awareness Month. And good luck with the Split the Pot Lottery.
Thanks,
Thanks, Lisa.
Thank you so
Appreciate
much.
it.